for the MSc in Sport and Exercise Medicine. Chris is a physiotherapist registered with Health and Care Professions Council. Chris has previously held postdoctoral research positions in rehabilitation at the University of Oxford and military physiology with Singapore's Defence Medical and Environmental Research Institute, along with academic positions in exercise physiology and physiotherapy. So we are very, very excited to have you with us. And he is joined by Akshit Jain, who represents University of Exeter in India as the senior recruitment advisor and someone who's been working very, very closely to build the University of Exeter's presence in India. I'm Amrita, and I'm joined by Devakshi, Kasvi, and Sonali from the team who are managing the webinar and all the information that's coming to you. And, just to make sure that we all make use of all the time that we have together, and we're able to reach to everyone's questions and comments, I'd like all of you to make note of the following aspects. All questions can go in the Q&A box. Please do not put them in chat. It's difficult to keep track of questions and, get to an answer. So all questions in the Q&A box. You don't need to wait till the end. We have a team that's readily available here who will be able to respond to your questions as they come along in the chat box. So as soon as you get the question, you don't have to hold on, put them in the chat box and we'll get to you, getting you an answer. If you feel that, you heard something very exciting, you didn't know, you loved hearing something, tell us with the emojis. Let's make full use of emojis on Zoom. It's always encouraging, heartening for all of us to get your reactions, however old we may have been in the classroom. So your response is really, really going to keep us going through the webinar. Any comments to come in the chat box, and I'm sure Dr. Chris may ask you questions, as he goes along, and those responses could also come in the chat. So all interaction in the chat box and all questions in Q&A, and feel free to use the emojis. With that, I hand it over to Dr. Chris to take us through a really exciting 50 to 60 minutes together and show us things in the career domains or in the work of world, which we may not have discovered yet. Over to you, Dr. Chris. Thank you.
Thank you. And I'm delighted to be presenting to you this evening, and a very good evening to you all. The title of my presentation is to give an insight into the world of sports medicine and sports science. So it's enhancing the health and performance of athletes with sports medicine and sports science. And I'm delighted to be a part of this Road Less Taken series. And I thank Acumen and the organisers for inviting me. So when I started off, when I was in your shoes a long time ago, I had an interest in sport. I enjoyed playing sport, watching sport, and then I realised that I was interested in the science behind the sport. But back then, sports science and sports medicine was not a real mainstream subject area, so I had to navigate my own path into this world of sports medicine and sports science. So I just want to give you some insights into that world and highlight some pathways into that world with this presentation tonight. So firstly, I'd like this presentation to have a little bit of interaction. So I'm going to ask you to scan the QR code or go to menti.com, and then I'm going to ask you some simple questions just about your interests. So please, can you use the QR code and join this Menti question. Okay, I can see that you're joining it. Thank you. Okay, I'll just give it another few seconds. Okay, let's go. Okay, so my first question. So I told you that I was a sports fan. I was brought up in the northwest of England, in between Liverpool and Manchester. So I had a simple choice. It was either I support Liverpool at football or Manchester United at football. So my favourite sport was football. So I just wondered what your favourite sport is. Okay, thank you. So we're seeing cricket featured prominently, uh, right in the centre, basketball, badminton, okay, football, athletics, tennis, table tennis. In the UK, we're typically, our sports are typically football, rugby, which is a contact sport, um, and obviously cricket. We have India being hosted at the minute for a test series. Okay, so a nice variety of sorts. Kabaddi, karate, running. Okay, interesting. I'm a big sports fan, like I said, so I'll be looking up some of these sports that I'm not familiar with. So thank you. Okay, my next question is who is your favorite sports team? Okay, so again, we're seeing the Indian cricket team featuring prominently. Mumbai Indians. Okay, we've got some Spanish football teams, Barcelona and Real Madrid, Manchester City. There is another team in Manchester, you know, that you might. I'm glad that we're not seeing Liverpool on there as a Manchester United fan. Okay, the Lionesses, that's an interesting one. They've just had a victory in the Euros. Okay, Japan volleyball team. Okay, really interesting, real diverse mix there. So thank you. Okay, now we're going to start trying to get a bit more specific. So I'm interested in your favorite player or athlete. Okay, can you name your favorite player or athlete? Okay, I'm recognizing some elite cricketers in there, some Olympic swimmers, basketball players, an English cricketer, Ben Stokes. Again, some of the others I'll need to look some of these people up. I think one person I admire for their longevity in sport is Cristiano Ronaldo. So I see CR7 there. So I don't know if he's 40 years of age yet, but he's still going and scoring goals. Okay, excellent. Okay, so my final question on this opening section. is about when you have a team and you have a favourite player in that team. Do you think your team performs better when your favourite player is playing? Okay, we seem to be getting a consensus regarding yes, but not always. So I'd like you to think what prevents your favorite player from playing. So if you were to go and watch sport, you'd really want to watch your favorite player playing the game. So what are the things that can affect a player, making them unable to play? That's something that I'm going to be touching on in this presentation. And there's been some examples in the Indian cricket team over the last few weeks where some big name players have not played for one reason or another. Okay, so I'd like to open up by using this statement here. I want to introduce the team behind the team. What I mean, the team behind the team is that behind every great sports team is an equally great sports medicine and sports science support team. Okay, so these are the people who work behind the scenes. They work on the touch lines. Uh, they may be first in and last out at the training centre. Okay, but they are a really valuable component for the performance of the whole sports team that you see sort of on the pitch or on the television or in the news. So this team is what I'd like to give some insights into. And it's become recognised now that player injuries lead to poor team performance. So if those favourite players are injured, and this affects team performance. So we're seeing in my world, we write and produce scientific publications to communicate our scientific findings. And there's been some really interesting studies come out where people have done real in-depth analysis. In this example, this is a Champions League study. They looked at data over 11 years, and they found that the best performing sort of UEFA Champions League teams were the ones who had the highest sort of, or the lowest injury rates, or the highest player availability. Okay, so this is some more data coming out this time from rugby union. Like I say, it's a real physical contact sport associated with lots of injuries. But the magnitude of a team's injury problem impacts their success. And finally, there's a massive financial cost, particularly in high profile leagues like the English Premier League. So players being injured affects team performance, and then that has a knock-on effect in terms of the finances that they get, maybe because of not qualifying for the European Champions League, not finishing in a high enough position in the league, maybe having to buy players in to cover injured players. So it's not just performance, there's a real sort of financial cost as well. So those injuries that we see affecting players have a sort of domino and effect that affects the wider organisation. And just to illustrate that here, so the statement that player injuries affect team performance. So on the x-axis here, we have injury burden, which is a measure of the size of the injury problem for a given team. So the greater the number is the greater the size of the injury problem. And then on the y-axis, so if we see this going up here, the bigger the problem. On the y-axis, we have the league points tally. So this is an actual rugby union study, but it could be the English Premier League or a cricket league. The higher the points tally, better performing the team. So what we have here is an inverse association. So as the injury problem goes up, the league points tally at the end of the season goes down. Okay, so that confirms that observation that injuries negatively affect performance. But on the other hand, if the injury problem goes down for a particular team, the points tally at the end of the season goes up. And this is really important for us as sports science and medicine individuals, because we can communicate that injuries significantly influence performance. Previously, this was suspected, but now it's been proven scientifically. Okay, and that would then in turn suggest that if we can prevent injuries and put resources and highlight the importance of preventing injuries, that can increase a team's chances of success. And then if we are talking to coaching staff, technical staff, we have a way of saying that we can benefit your team's performance if you put resources into injury prevention, sports medicine, and sports science. And so these are the messages that are filtering through now to high-level, high-performance teams and sports. And I've taken one random example here. This team, Manchester United, they had a state-of-the-art training complex called the Carrington Training Complex that houses things such as sports science, sports medicine facilities, gyms. They've got an MRI scanner in there. And over the last couple of years, they've really had an injury problem. So their injury burden was very high. And it was associated with a poor team performance in the league. So their performance in the league has not been very good over the last couple of years. So in the last 12 months, the owners have dedicated a £50 million increase in spending on this facility and on staff to try and make it the best in the world. So that's the importance that they put on sports science, sports medicine, and trying to improve performance and decrease injuries. So I'd just like to now go on to the sports medicine and sports science support team. So who are these people who work in these type of environments? Yeah, what sort of professions are they, and how do we get into those professions? So if we start with the sports medicine team, when I think of a sports medicine team, I think of managing the athlete's health. So that could be managing injuries and managing illness. So when we think of that, we probably think of a physician or a doctor, a physiotherapist, and then there are much more sort of diverse roles entering this world as well. So a trainer might be a strength and conditioning coach. We might have a specialist sort of muscle, soft tissue therapist, a podiatrist who deals with foot problems. So apart from physical health of athletes, we also have psychologists who deal with the mental health of athletes. So particularly when athletes are injured and taken away from their sport, it can have a real strong psychological impact on that athlete and lead to problems in mental health. So psychologists are a real key part of this team now. And a dietitian deals with nutrition. So is there anything that we can do to speed up rehabilitation when an athlete's injured by looking at their nutrition? So that is sort of the sports medicine team, who have the aim of trying to return athletes to sport quickly, but also safely. In elite sport, time is in very short supply. And when an athlete gets injured, the first question they ask is, when can I return to sport? And now with science, we've got a much more detailed understanding that for a particular type of injury, whether that's a muscle strain, a tendon rupture, a ligament rupture, a concussion, we know that within a margin of error, we can predict the time it takes to return to sport in days. But we also know that when an athlete's had one injury, they are much more likely to get re-injured, so re-injure the same body part when they return to sport. So we need to make sure that we're returning athletes not only quickly or optimally, but also safely so they don't get injured again. Now, if we move on to the sports science team, when I think about the sports science team, I think about improving performance. It's always about trying to improve performance on the sports field. So we do this in different ways. We understand the body's response to training and the individual's response to training, and we try to optimize training to get the maximum benefits out of it with minimal fatigue. We know that the positive adaptations to training don't occur during the training session themselves, but during recovery from training. So we try to maximize recovery as well to make sure that athlete is ready to go for the next training session or the next competition. So optimizing preparation and recovery from competition is really important as well. You'll appreciate that in elite sport, the matches or competitions usually come thick and fast. Yeah, it's like in the English Premier League, matches are twice a week, sometimes 3 times a week when it's domestic league, domestic competition, cups, and European sort of competition. So we have a team of sports scientists who are trying with a collective goal of achieving this, improving performance, optimizing training, and optimizing recovery. So we have people called physiologists or exercise physiologists or sports physiologists, and I would put myself in that camp. We have psychologists who are dealing with sort of the mental health and getting prepared for competition. We have strength and conditioning coaches who are all about training athletes in health and also when they're injured as well. We have nutritionists who are looking at providing a detailed nutritional diet to optimize training, recovery, and competition. And then we have people who are experts in the sort of physics and mathematics of joints and forces impacting on the body, and they wear the biomechanics hat. So these people, like I say, I consider the sports scientists. Again, the people behind the scene trying to improve the performance of athletes. Now, over the last few weeks, we've had an amazing test series in cricket between England and India. And I've been watching with interest. I've been looking at with my physiotherapy hat on. So I wear 2 hats. I'm an exercise physiologist, so I'm in a sports science camp, but I'm also a physiotherapist, so I'm in a sports medicine camp as well. So I've been watching with interest. There's been tests that have been squeezed together in a short space of time, and we've had the usual mix of injuries. We've seen people playing with a fractured foot, Pant, for example. We've seen just the other day the England cricketer, the last man, coming out with his arm in a sling. We've seen individuals such as Bumrah, who looked like he's had his workload managed. He's played one test, missed the next. And I've looked in the news, and it seems like India really bought into their sports medicine and sports science. There's been a growth in jobs available for physios, strength and conditioning coaches, rehab specialists, sports scientists. And in at the end of January, early February, I went on a visit with the University of Exeter. There was a delegation of sports scientists and sports medicine staff, and we went to develop a collaboration with IIT Delhi in the area of sports medicine and sports science. And I was fortunate enough to listen to a lot of Indian speakers from around the country who are involved in sports science and sports medicine, and they talked about the growth in university sports science and sports medicine, in high performance centres. I was shown some really elite training facilities, testing facilities, just like the type of facility we see at Manchester United. So I really think I detected a real sort of growth in the area of sports science, sports medicine, and health, and a lot of big names investing money in this area. So I think it's a real future area for growth. If you've got an academic interest in one of those subjects and an interest in sport, I really strongly advise you to follow that interest. Okay, so I just mentioned one of the world's elite fast bowlers. So Jasprit Bumrah, who's been on English shores for the last month or two. I've been interested in his history. He's got a very interesting injury history. He's had recurrent back injuries. He's currently struggling with a knee injury. And he's had a stress fracture in his back and his lumbar spine, which may seem unusual, but is quite common in fast bowlers because of the bowling action and the repetitive stress on the lumbar spine over time, over bowls and innings and competition and practice. This can produce a micro fracture in one of the vertebrae of the lumbar spine. And it can require surgery, or it can require conservative treatment, which means rest and rehabilitation, but it usually takes a very long period of time to recover from. And I noted that Bumrah had been absent at one time for over 1 year from international cricket. So if you've got your top player absent from your team, that's going to reduce your chances of success. I've seen over the series that it seems like his performance, his bowls bowled greater than 140 kilometers per hour seemed to drop off over the series. Whether that was intentional or whether that was due to fatigue or workload management remains to be seen. But there's some interesting scenario going on here, and I think this individual will be monitored and managed closely by not only the sports science team in terms of his performance and recovery, but also that sports medicine team treating injuries, trying to prevent recurrence of his back injuries. So I just wanted to next ask you, so who in the sports medicine and sports science team do you think will be helping Jasprit Bumrah, okay, to maintain his health and maintain his performance? So we'll have people with a sports medicine hat on and people with a sports science hat on. So all those professions that I listed previously, who do you think would be helping this individual to stay healthy? So I'm just going to... So again, I just want you to try and list, and if you can put a name, a profession that you've heard in this presentation, who do you think would be helping him to achieve success? So could it would be one of those ologists that I mentioned? Could it be? Okay. Okay, I encourage you to all have a go at this. Okay, so the physio is appearing prominent. The sports physician, so the doctor. So typically the physio and the doctor will be involved in diagnosing any injuries, treating those injuries. They'll also be involved in trying to manage previous injuries, to make sure they don't come back. We would have a strength and conditioning coach working with him, making sure that his body's strong to withstand those forces that he exerts through his body during that fast bowling action. Soft tissue doctor, yes. Dietitian were probably involved, yes. Almost all of them. Okay, brilliant. Okay, excellent. I would agree with all of these. Yeah, I think there's going to be that big team behind the scenes, out of the spotlight, but really working hard with him to try and keep him at his best. Okay, excellent. Thank you, everyone. Okay, I've talked a little bit about elite sport, and that's what brought me, my interest in sport, brought me into this world. But during my time in sports science and sports medicine over the last 25 years, we've seen massive developments in knowledge relating to the benefits of physical activity for our mental and physical health across the lifespan. So that's from children to older adults. So it seems that it is considered, and the Americans consider exercise as medicine. They have a slogan that says exercise is medicine. It's that good for you. It benefits, like I said, children, adolescents, young adults, middle-aged adults, older adults, people living with a long-term condition, people living with disabilities. It seems to have this really consistent treatment effect, that if we undertake exercise, so that is structured physical activity or just recreational, sort of unstructured physical activity, we get these amazing benefits. And so there's a big world of trying to sort of mobilize, say, the populations to undertake physical activity and to guide and prescribe physical activity for individuals to optimize their health. And this little infographic here is a summary of UK Chief Medical Officer's guidelines, recommendations for physical activity. So this is some of the strongest evidence that we have to try and encourage us to be more active. So for aerobic exercise, it is recommended that we undertake at least 150 minutes of moderate intensity exercise per week, which is about the equivalent of a brisk walk. If you're looking at running, jogging, that's 75 minutes per week would be sort of the minimum dose to achieve health effects. It is recommended that we undertake resistance training, so strength training at least twice a week. We try and minimize sedentary time, sitting, which is easier said than done with a lot of jobs that we do. And particularly for older adults, we should try and maintain our balance, our ability to maintain balance, because we know falls in older adults can be a real source of trauma and ill health. So I just wanted to put that in. Yes, elite sport does attract a lot of students, but there's a big initiative going on and trying to bring physical activity and advances in sports science to the whole population to try and improve health. And I sensed that in India as well when I was over in January and February. Okay, so from a practical perspective, if you're interested in this world, how could you go about trying to get into this world? So the most obvious pathways would be a BSc, which is an undergraduate science degree in sports science, exercise and sports sciences, those sort of keywords. If you're interested in medicine, you would need to undertake standard medical training first and then go on to specialize as a sports medicine doctor. Another obvious pathway would be in physiotherapy, so undertaking an undergraduate degree in physiotherapy and then specialising in sports physiotherapy. If you're interested in any of these, biology, physiology, nutrition, psychology, we know that you can undertake a biology, nutrition, psychology degree at undergraduate level and then follow up with some sort of specialist training or study to try and specialise in the sports world. And elite sporting organisations now are collecting so much data. So physiologists, strength and conditioning coaches, psychologists, movement, performance analysis takes place, and people with mathematics and data science skills are in hot demand to try and manage and make sense of that data and make it useful for the coaching team. So yeah, if you're into big data and there's sport and you've got an interest in sport, then there's opportunities there as well. So this would be sort of your next step. So looking at degree courses. Following a degree, we see a lot of students, particularly Indian students, come to the UK to do a one-year MSc course, and I run a sport and exercise medicine course, and we attract a lot of international students to come and do 1 year and turn their undergraduate expertise into really sport-specific expertise. And then we see a lot of our MSc sport and exercise medicine students go on to work in things like elite sport. Other specialist pathways at postgraduate level at MSc are sports nutrition. So if you're interested in the diet, nutrition, sports performance, optimizing sports performance, you can specialize in sports nutrition. If you're interested in business or marketing or finance and you've got an interest in sport, then again, you can combine those and undertake an MSc in sports management. And again, we're finding that really popular with international students as well. Okay, I'm just going to pause there for a second and check if there are any questions in the chat at this stage.
Hi, Chris. Chris,
Hello.
I'll help you navigate a little bit. We've answered a lot of questions in the chat box, but I think there are one or two very typical questions. So there's one from Rupan. She says that I'm a student of physiotherapy. What is the ideal path
Yeah.
to move towards elite sports physio?
I would say, yeah, the ideal path would be an MSc in sport and exercise medicine or sports physiotherapy. And during that time, I would be trying to get experience with whatever athletes you can get your hands on or get contact with. So I know I've sat on recruitment panels at a professional football club, and we've been recruiting people like sports scientists and physiologists. And what is valued is their qualifications, but also their motivation to go and work with low-level athletes, school athletes, college athletes. They don't need to have worked with, Manchester United to get a job at Manchester United or Real Madrid or whatever. It is that sort of real-world, low-level experience where you're learning your trade. So I'd say yes, the knowledge gained from an MSc qualification and the experience gained from working with some athletes at whatever level will allow you to enter elite sport. Okay, I'm going to continue. Okay, so the next part of my talk is to give you an insight into some of the work that I do with my sports medicine hat on. So I've realised that during my journey, I developed an interest. I realised that I like helping people, and there's no better time to help people than in the sort of hour of need. And in sports medicine, that hour of need is usually when they've had an injury. So I spend a lot of time trying to help people return to sport when they've had serious knee injuries. And there's three players here, you may recognise them. So the first one is Rodri. So he is a holding midfielder for Manchester City and Spain. We have Gabriel Jesus, who is an attacker, centre forward for Arsenal and Brazil. And then we have Neymar, the attacking footballer for Brazil. So all three of these individuals suffered a knee injury, an injury to the anterior cruciate ligament. And the thing about this injury is that it's not very common, but when it happens, it keeps people out of sport for a long time. So I just want to look at the anterior cruciate ligament, abbreviated to ACL. You may have heard ACL in the news, ACL injuries. It keeps people out for a long time. So here on this diagram on the left, we're looking at the knee joint from the front. So this bone is the fibula. It's on the outside of the knee and the shin. And then we've got the main shin bone, which is a tibia that runs from the ankle up to the knee. And then this bone is the thigh bone, which is the femur. So if you do sports medicine, you'll be doing a lot of anatomy and learning all these terms. Okay, so here we have two ligaments in the knee that cross over, and it's where cruciate, and that's where the name for the cruciate ligaments is, refers to this crossover appearance here. So the anterior cruciate ligament here goes from the femur to the tibia. And when the knee joint finds itself in this position, it puts strain on this ligament and can lead to it actually rupturing, splitting in two, losing its function entirely. And this type of knee action often occurs in team sports, in sports where you land from jumps, so basketball and netball, in sports where you change direction quickly, so that might be football, American football, basketball, cricket would fall into this camp as well. So this is an injurious position for the anterior cruciate ligament. And so I see quite a lot of young athletes who have ruptured the anterior cruciate ligament, often under non-contact situations, just when they were changing direction. So there's a timeline associated with this injury. First of all, we get a diagnosis. This is a doctor or a physio doing a manual test on the knee joint to see if that knee joint has got increased laxity associated with a ruptured ACL. Typically in high performance sport, the athletes get sent for an MRI scan. And here we can see an anterior cruciate ligament that has lost its integrity. The two ends here are not connecting. So that will confirm for definite that an ACL rupture has occurred. If these athletes involved in sort of high performance sports, change of direction sports, want to get back to their previous level of competition, they will typically need surgery. So the surgery takes one of two forms. It either takes a piece of the patella tendon, which is the piece, the soft tissue, the tendon under your kneecap that runs to the top of your shin bone. So they take the middle section of that with a bit of bone on either end, or they will take a piece of the hamstring tendon, which is the muscles on the back of the leg, on the back of the thigh. So they use what we call an autograft from the patella tendon or the hamstrings That's a piece of your own tissue, and they replace the damaged ACL with this tissue and fix it in place using surgical techniques. And then there's a rehabilitation program. And this rehabilitation program typically takes about 9 to 12 months to be completed before the athlete is ready to return to sport. So athletes, coaches typically think that rehabilitation and return to sport follows this sort of straight line pathway, but physios and doctors and strength and conditioning coaches will tell you it takes this sort of pathway. We get breakthroughs, we get progressions, but then we get regressions. But as long as we keep working, keep progressing the rehabilitation, eventually we will arrive at our destination. But this is more of a real world scenario than this straight line approach. And that typically relates to most injuries as well. So this is an individual who's about 8 or 9 months post ACL surgery, post ACL reconstruction, and they're undertaking some physical performance tests in our laboratory, in our lab. This one involves measuring strength of the quadriceps, which is the thigh muscle at the front, and the hamstrings, which is the thigh muscle at the back of the leg. And here he is undertaking a vertical jump test on a piece of kit. So we're using some specialized pieces of kit here. And what this individual wants to know is if he is ready to return to sport. And it's really important that we get this decision right, because athletes have about a 1 to 3% chance of having an ACL injury the first time. But once they've had one, when they go back to sport, the chances of having another injury, either on the same knee or the alternative, the opposite knee, that is rupturing the ACL graft or rupturing the intact ACL ligament on the opposite knee, goes up to 20 to 30%. So we get a dramatic increase in risk. And I believe it is because we're returning to athletes perhaps to sport too soon, or perhaps we're not undertaking this type of testing to make sure that our decision making is correct. And we know for certain, using science and numbers, that they are ready to return to sport. So when I am advising athletes on their return to sport following ACL injury, knowing that there is an increased risk of re-injury, I use a battery of tests. So there's 6 sort of criteria here that they must pass, all of them. So I use the strength testing machine for the quads and hamstrings, and I use a limb symmetry index that needs to be greater than 90%. So the limb symmetry index is a simple index. It expresses the injured limb strength as a percentage of the uninjured limb strength. So they must exhibit 90% strength in the injured limb compared to the uninjured limb. So that is less than 10%, what we call asymmetry. We do simple hop tests, so single leg hop, triple hop for distance, triple crossover hop. And again, we use the limb symmetry index of greater than 90% performance on the injured versus the uninjured leg. We use a running T-test time, which is an agility test, a sprint test, change of direction, and they must complete this. This is for male athletes in a specified time. And their rehabilitation must have had a component where they're out on the pitch undertaking running drills, change of directions, jumping, landing, doing sport-specific rehabilitation, not just work in the gym. They must be doing the sport rehab on the field as well. So they must have had a period and completed that satisfactorily. So I'm going to show you some sports testing with 2 athletes. So here we have Toby, who I said is about 9 months post ACL reconstruction on his right knee. And here we have Ethan. Again, he injured his ACL ligament and had surgery on his right knee. He's about a month behind it. I think he was about 8 months post surgery. And here we have a team of our MSc students who are involved in developing competency in using this laboratory, this sort of gold standard laboratory equipment that you'd find in those elite sporting organizations around the world to measure sort of athlete strength. Okay, so I've got a video here. I'm going to ask you the question that we ask. So Toby in this video, he wants to return to sport. He's had his sport taken away from him for the last 9 months. He's had surgery, he's been in hospital, he's recovered, he's spent a lot of time in the gym, he's gone and done his sport-specific rehab. And he wants to know from me and my team of students, am I ready to return to sport? So what we asked Toby, we asked him to push against this machine with 100% effort as hard as he can for 5 reps. And we compare his injured leg with his uninjured leg. So I just want you to determine if Toby is pushing against it with 100%. Is he giving it his all? Okay. I think you'd agree with me that that is someone giving 100%. Okay, that's all we ask, and we get our data from that, knowing that it was a maximal effort on his injured leg and his uninjured leg. We also do some vertical jump tests. Again, Toby here is stood on some state-of-the-art equipment. These are force plates under his left and right foot. And during a simple jump, we can get lots of metrics to determine whether his left uninjured leg is putting same or greater force through this force plate during this jump test on jumping and landing than his injured right leg. Okay, so he looks pretty good there in his performance. I'll say someone's got their hand raised, so I just was there something in the chat before we move on?
Hi, Chris. I think this was Sachin. Sachin, is there anything that you would like to say or ask? That's okay, Chris. I think we'll let him drop his
Yeah.
question in the chat box. We'll address it later. Thanks, Chris. Thanks.
Okay, I'm going to ask you. Yeah, I am going to ask you a question. I'm going to show you Toby's data next, and I'm going to ask you: is he ready to return to sport? Based on what I've told you previously about those tests and those thresholds that he needs to match. Okay, so I'd say go back to that jump. Okay, that looked like a pretty excellent jump to me, but what we do is use the data from those force plates to indicate whether one side is compensating for the other or whether he's got that symmetry, both sides are equal. And sort of without showing you the data, I'm going to show you the data for the strength test, but Toby's jump test data reveal that he still had big asymmetry. So his right injured side was much down compared to his left. Okay, so this is Toby's data for his quadriceps, so his thigh muscle strength on his left side, which was his uninjured, and his right side, which was his injured side. So 350 versus 313. The higher the number, the stronger. So that's his average strength over 5 reps. When we compare his left and right, so his right side was injured, the limb symmetry index comes out at 89.6%. And we use a traffic light system. In this case, he's got an amber light here because his asymmetry is between 10 and 20%. If it was less than 10%, it would get a green. If it was greater than 20%, it would get a red. So that is in his quadriceps. So his right side is down. On his hamstring, so the back of his leg, His numbers are 172 and 154, so that comes up at 89.3 on the limb symmetry index, and he gets an amber for that. So we'll see that on average, his hamstrings are about 50% of his quadriceps strength, which is normal. It's usually about 40 to 60%. So that's something we look at as well. Okay, so I'm going to ask you a question. Based on that data, is Toby ready to return to sport? Can you answer that? Is it a yes? Is it a no? Or are you uncertain? Okay, so I'm looking at his limb symmetry index for strength, which is 89%. So have you heard anything based on the criteria that we use in sports medicine to determine whether someone with an ACL injury is ready to return to sport? Okay, I'm just going to give it another 10 seconds. So I'd encourage you to have a go. What comes into your head first? Okay, so those that answered no are correct. So if you remember, the criteria was he had to achieve 90% or above. He achieved 89 point something percent. So he's a fraction of a percentage off achieving that limit. But even when he's that close, because of the risk and the consequences of having a second ACL injury, the decision is that he is not ready to return to sport based on that metric. You remember that there's a whole other lot of tests that we use as well. So we need to pass all his jump tests, his sprint tests as well. So that's just one example of using sports medicine, using some objective tests to increase our decision-making ability. And I've just got another, I just want to quickly show you, this time Ethan, is he given 100% in his test? Okay, yes, he is. We asked him to give 100%. He gave us 100%. That was his uninjured side, more of an explosive kick test on that one. This was his injured side. We've slowed it down to look at the effort that he's putting in. He wants to get back to his sport. He's pushing with his quads, he's pulling with his hamstring, he's giving maximum effort. We couldn't ask for anything more. I can trust that data that comes off that machine and make my decisions based on that. Okay, so the data that was his most recent test. This is just looking at his hamstring strength. So his left side, his uninjured side was 158, his injured was 127. His limb symmetry index is 80.1%. We have data for him pre-injury and then during his rehabilitation. I'm not going to focus on that. I just want to focus on this 80% score that he achieved for his hamstring strength, for his limb symmetry index. So is Ethan ready to return to sport? Okay, so he achieved 80% strength on his injured side versus his uninjured side. Remember that threshold that he needs to achieve to pass that test. Did he achieve it? Is he ready to return to sport? Okay, so those that are answering no are correct. So Ethan did not achieve the 90% limb symmetry index. Okay, so again, that was we're preventing someone returning to sport with weakness in their injured limb, even at 8 and 9 months post surgery. If we didn't measure it, he would return to sport not knowing that and be at risk of re-injury, which is the worst case scenario. Okay, so what were our conclusions on these two athletes? So both athletes were advised not to return to sport. Again, you can imagine the psychological impact of that. Okay, they're really motivated to want to go back to sport, they want to train with their friends, they want to compete. But we thought for their safety and long-term health, they should continue their rehab and come back for testing at a later date. So both athletes did that. They returned, they've passed the follow-up tests, and now they're in pre-season training, ready to return to sport. So I think from my perspective, I'm happy that these athletes have taken that approach, used objective testing, and we've used sports science and sports medicine to help them not return to sport in a risky but quick fashion, but return to sport in a safe but albeit longer fashion. Okay, so I hope you've taken something from this talk regarding the world of sports medicine and sports science. If you're interested, I would encourage you to follow your interest. There's some sources of follow-up information here, some British organisations relating to sport and exercise medicine, sports science, and this is the UK sort of elite sports institute that provides sports services to athletes who are funded by UK Sport. And finally, we've got sports science at the University of Exeter. Okay, I'm happy to answer any questions that you may have, and I'm really thankful of your attention and hope that that might have stimulated some interest and you might have learned something. But anyway, thank you very much.
Thank you, Dr. Chris, for a very intense yet engaging session. And we could see some very small muscles playing a big role, and the care and attention that is needed by the massive support team behind that one person that we see on screen and tend to cheer for. So I think it was really eye-opening, and I mean, I'm thinking, like, really, is there so much work, like sometimes you just, the way people, the way sportsmen are playing on the field, you assume it's so natural, right? Like, you don't assume the effort and the strategy, the planning, all of that that goes behind. So thank you for a very, very intense and, interesting session. Thank you for creating all those polls and asking us questions as you went on to share more. I do want to encourage everyone to ask questions or your comments in the chat, questions in the Q&A box, comments in the chat box. And I'm going to have my colleague Devakshi just leave you with the feedback form in the chat box. So before you go, if you could just quickly, click on the link there and make sure that you're giving us your feedback. That'll really be useful. Akshit, I do see 2-3 questions coming in the chat now.
Yeah.
Around scholarships and the
There's
programs.
there's I think 2 or 3 questions which Chris can answer. This is around what do sports psychologists do in the UK? And then there are some that I can answer. Okay, I'll take the lead and answer the one which Harshveer Singh Kalra has asked. How many years does getting a degree in sports science take? Both bachelor's and master's. So Harshveer, bachelor's typically in the UK is for 3 years, master's for 1 year. Although exclusively at Exeter, we do 3+1 format as well. So this can be industry placement year, or this can be a study abroad year with one of our partner universities across the globe. So this can eventually become a 4-year bachelor's and 2-year master's as well. Now the 2-year master format is limited to roughly 10-15 odd courses, similar to bachelor's, 1-year tuition, 1-year industry placement. So this can be optional 3+1, optional 1+1, but typically it's 3+1. So I hope that helps. And it's the exact same format in sports sciences and medicine as well. Chris at some point in his presentation mentioned 4-5 bachelor's programs, 3-4 master's program that we offer, which is very close to the presentation that we had today. If your interest lies in this space. So all of those programs, similar format, 3 and 1. Okay, so that's answered now. What scholarships are available for students seeking to pursue MSc Sports Science Physiotherapy outside India and the UK? Rupam, that's a very broad question because this is not just limited to Exeter. You're mentioning, you're taking into account all UK universities, and I can talk about Exeter. We offer £5 million in international scholarship, Rupam. So we are one of those universities which are really, really generous, and our portfolio is huge in terms of distributing scholarships. They come in two formats at Exeter. One is automatic and guaranteed. So I'll take an example for the scholarships that we had for this year, September 25, which are now closed because it's very late in the cycle. But when we opened up, we had the £3,000 automatic and recurring scholarship for all 3 years. So that's 3,000. That's £9,000 for your overall degree. That was automatic and guaranteed for all Indian UG students. It was a regional international scholarship. Over and above, you have your merit scholarship, which is based on prestige. So that's called the Exeter Excellence Scholarship. It comes in two formats as well. So this year it was a recurring 333 or a 555 over and above the current three. So if you put in a scholarship application and you get £3,000, then you already have your automatic scholarship of 3. This now becomes 666. Or if you get the £5,000 Exeter Excellence Award, then it becomes 3 plus 5, 8 for all 3 years. So that's £24,000 for your overall degree, which is why I said that we are huge in terms of distributing scholarships. And of course, we get fantastic students, so you all deserve it as well. Scholarships are not out for September 2026 intake. So there's very little that I can talk about for next year or years after that. Be in touch with us. Of course, we'll let you know, what the scholarships are. I'll drop my email ID at some point, so be in touch with me over that, I think. There's an anonymous attendee who have asked, can we see the undergraduate and postgraduate courses? Yes, I'll drop the link in the chat box for all our courses in bachelor's and master's. That's easy. And now I'll direct one question to Chris. This is from Rupam Nanda again. In India, how does this work? MPT after BPT? What are the prospects?
So yeah, I think does this refer so typically students would study an undergraduate degree, BSc, or whether that was, whatever the label of the degree is. So it'll be undergraduate, sports science, physiotherapy, whatever it is, followed by a master's degree, sort of masters of physiotherapy, master of science. So yeah, it'd be 3 years undergrad or 4 years undergrad, followed by 1 year of MSc postgraduate taught course. So the MSc that I run has a typical format that you'd find at other universities. So it's 1 year full time. It runs from mid-September to mid-August. So yeah, 11 months. And then they will qualify with a master's degree in whatever subject.
Perfect. Amrita, Devakshi,
But
was there
still,
any questions we
no
missed?
return slide yet.
Yeah, I think I did see another question. Okay, there is a question on the no return slide. Was there a no return slide? Yes, I think about.
I can go back through, so just tell me when to.
And I think there was a
stop.
request for another slide as well.
It's a no return slide. Oh, I'm not sure which slide is being requested. Yeah, my point was on this one is that this number needs to be 90% or greater. So this is 0.4% down, this is 0.7% down, but we've got to be objective and draw the line and use this data to inform our decision making. So that was very borderline, so I could see that might be tricky. But the next one, okay, this was 80.1. It needs to be 90 or greater to pass our test. So this was much more clear cut on this one. And this was just one metric, hamstring strength. You can actually see on this was pre-injury. We tested him when he was healthy pre-injury. And his hamstring strength on his right side, which is the one that he subsequently injured, was 163, and 9 months after injury, it's 127. So he's not even back up to his baseline that he was pre-injury. A lot of the time, we don't have this pre-injury information. So this information. So this was 2 weeks after he got injured, May 2024. We didn't test his right because that was his injured side. But then we can see his hamstring strength was decreased and it's not got back up on his injured side. So he's got a bit of a way to go. You know, we had to send him back to rehab, and he got there in the end. Yeah, but for me,
Thank
the
you.
worst outcome for me would be this athlete gets injured again. So if I do some tests, the tests don't meet my criteria, which are based on the best available evidence around the world, and I clear him for sport and he gets injured, that is just not an outcome that anybody can be happy with.
Great. Thank you, Dr. Chris. I think we're at the end of the session with no more comments in the chat or questions in the Q&A box. Thank you for, showing us what we have not seen before. And Akshay, thank you for very, very, managing all the questions along the way on spot and quickly. And thank you, Exeter, for coming forward to do this for students, counselors, and parents. Thank you. And to all of you who are here, we have sessions every Wednesday. Please look into your school calendars and see what's coming up next. Thank you. Thank you, Devakshi, Sonali, and Kasvi. Thank you. Bye-bye. Enjoy the rest.
Thank you, everyone.
Bye. Bye, everyone.
Bye-bye. Good evening. Bye. Bye. Chris, that was fantastic. Thank you so much.
All right.
It was awesome. Really engaging. Did not feel like a one-sided kind of a communication. It was a dialogue. The minute I looked at the presentation, I knew it was going to be a blast. And yeah, just thanks a lot. I think we'll do